You've seen it, maybe even done it. The treadmill stress test, a common screen for heart health for decades. But what if over 60% of heart attacks are caused by a type of plaque this common test almost always misses? Stress tests are designed to find severe blockages, like plumbing problems, not the most frequent cause of a heart attack. This creates a dangerous blind spot, giving a false clean bill of health just weeks before a major cardiac event. We are now exposing the limits of the stress test, the hidden biology it can't see, and what truly predicts your risk. So how does it work? It pushes your heart to demand more blood. A blockage of 70% or more flags an abnormality. But the data is clear. Most heart attacks come from smaller, non-obstructive plaques that don't trigger the test. Even a nuclear stress test, which uses imaging, still seeks the same thing, a major reduction in blood flow. This makes stress tests poor predictors of future heart attacks. They screen for a symptom, not the underlying disease. Think of it this way. The test is looking for a clogged pipe. The real danger is a weak, inflamed pipe wall ready to burst. So what is this weak pipe wall? To see the test failure, you must understand what it ignores: inflammation and plaque stability. A heart attack is a sudden event. A soft, inflamed plaque ruptures inside the artery. A blood clot forms, and that clot blocks flow. A stress test cannot see inflammation. It only sees flow. So how can a large, dangerous plaque exist without blocking flow? The answer is positive remodeling. As plaque grows, the artery wall can expand outward, preserving the channel for blood. This means you can have a huge amount of hidden plaque, ripe for rupture, and still pass a stress test with flying colors. The test also completely misses microvascular disease, a problem in the heart's smallest vessels causing real chest pain. These blind spots lead to two very different but equally dangerous outcomes: false negatives and false positives. First, the false negative, the all clear. You're told you're fine, so you don't seek further treatment. This can be deadly. Then, the false positive. An alarm sounds for a problem that isn't there, causing immense anxiety and invasive follow-up tests. Whether it misses a real problem or finds a phantom one, the inaccuracy creates a cascade of negative outcomes. This is why medical professionals state a stress test is a screening tool, not a definitive diagnosis. It is only a starting point. But the story gets even more complicated. The test's reliability isn't the same for everyone. Its accuracy can plummet. A significant issue is its reduced accuracy for women. Differences in physiology can lead to a cycle of unnecessary testing. Consider patients with diabetes who often have silent ischemia, a lack of blood flow without classic chest pain, fooling the test. The list goes on. Inability to reach target heart rate and certain medications can distort results. The test assumes a uniform patient. Given these limitations, does it make sense for healthy people without symptoms? Medical guidelines say no. Let's put the pieces together. We have a test designed to find severe 70% plus blockages, but we know most heart attacks come from smaller, non-obstructive plaques we mentioned at the start. This is the basic mismatch. We asked how dangerous plaque hides. The answer is twofold. Positive remodeling conceals its size, while inflammation makes it rupture. Relying only on a stress test is like trying to predict an earthquake by looking for traffic jams. You're measuring the wrong thing. The conclusion is clear. The stress test has significant, often dangerous, limitations. It provides a deceptive sense of security. This isn't meant to cause fear, but to give you power. Understanding these limits is the first step to a better heart health assessment. Modern cardiology has tools that directly visualize plaque. A coronary artery calcium score, or a CT angiogram, can see what a stress test is blind to. The next step is to have a more informed conversation. Ask your doctor not just, is my blood flow okay, but what is my actual plaque burden? Don't settle for a false sense of security. Demand a clearer picture. True prevention starts with truly understanding your risk.